when you ask what are the questions about mental health, it's quite complicated because industry-wide, having people work remotely and the ramifications of that are quite different than families that might be dealing with autistic children or individuals who are depressed. I certainly think that I would want to consider the impact of the pandemic on women and women's issues. I think that juggling working and managing childcare is very complicated and has caused a great deal of depression and anxiety.
What primary care physician has the time to spend with a patient who needs to go through their whole mental health history, especially with reimbursement? And so what do you try and do? You try to get them out to see a psychiatrist. What city or area has enough psychiatrists to handle all of those patients?
So I have a problem with telling everybody that has experiencing, I mean, obviously, if you're experiencing severe depression, anxiety, you need some clinical help. But, everybody that's getting anxious or having some sort of depressed mood, I don't know that they necessarily need to seek a doctor's advice to help them with that. And I'll tell you, if they do seek a doctor's advice, they may get put on a medication that they don't necessarily need.
I would call it connection, right? It's connection versus our current digital disconnectedness of society, in my mind. And the other, how many primary care providers were prepared to be therapists and or psychiatrists? Most of us were not. Probably in the last 5 years, I've done more mental health than almost anything else because those are the problems that are being presented on a regular basis.